Imagine this, you go to bed feeling perfectly fine, and by morning, you can't lift your arm, your speech is slurred, or your balance is gone. No warning, no pain. Just like that, your life has changed. For many older adults, this frightening reality isn't caused by smoking, a bad diet, or lack of exercise, but by something they thought was helping: vitamins. Yes, really. Millions of people over 60 take supplements daily for their bones, energy, or memory. And while some do help, others, especially when taken in high doses or at the wrong time, can quietly increase the risk of stroke, brain bleeds, or sudden blood pressure spikes. Today, we're diving deep into 5 common vitamins that could put your brain in danger without you even knowing it. If you've ever taken vitamin D, B6, A, or niacin, this might be the most important health video you'll ever hear. So let me ask you, have you ever wondered if your vitamins could actually be doing harm? Think about it for a moment, because what I'm about to share might surprise you. Let's begin with the most surprising of them all, vitamin D. You've probably heard it's good for your bones, your mood, and your immune system. And that's true in moderation. But here's something most older adults are never told. Too much vitamin D, especially taken at night, can quietly raise your risk of stroke. I'll share the story of Walter, a retired Navy veteran who took his health seriously. Every morning he lined up his supplements, including a 10,000 IU vitamin D capsule. He thought he was protecting his bones. But one morning his wife found him confused, unable to speak, his right arm limp. He had suffered a stroke overnight. His blood tests showed dangerously high calcium levels and stiffened arteries. The culprit? Vitamin D toxicity. When vitamin D levels are too high, calcium builds up in the blood. That calcium doesn't just disappear, it hardens the arteries, making them stiff and narrow. Add in dehydration, poor sleep, and aging blood vessels, and you've got the perfect storm for a stroke while you sleep. The scariest part? There are no warning signs. You go to bed feeling fine and wake up with your life forever changed. Here's what's even more alarming. Many over-the-counter vitamin D supplements contain way more than seniors actually need. 5,000, 10,000 IU taken daily, often without testing. But studies show that even 2,000 IU a day may be too much if you're not deficient. So if you take vitamin D, make sure you get your levels checked regularly. And always take it in the morning, never before bed. Now if that surprised you, the next one will make you think twice. Vitamin E. Often called the heart helper. Many people take it for circulation, memory, or skin health. But in older adults, too much vitamin E can increase the risk of brain bleeds. Let me share the story of Evelyn, an 81-year-old retired librarian. She was sharp, witty, and careful with her health. She had a heart valve condition and was on a blood thinner. But when she added an 800 IU vitamin E capsule to help her memory, disaster struck. Within weeks, she was rushed to the ER with a severe headache, confusion, and vomiting. A brain scan revealed a hemorrhagic stroke, bleeding inside her brain. The culprit wasn't high blood pressure or a fall. It was the combination of blood thinners and high-dose vitamin E, which had thinned her blood so much that a vessel in her brain burst. Here's the truth. The recommended daily intake of vitamin E is only about 22 IU. Yet most supplements contain 200, 400, or even 1,000 IU per pill. And when combined with medications like aspirin, Plavix, or warfarin, the risk of internal bleeding rises dramatically. Evelyn survived, but her memory was never quite the same. Her story is a powerful reminder. If you're on heart or blood pressure medications, always talk to your doctor before adding vitamin E. By now, you're starting to see the pattern. Vitamins aren't automatically safe just because they're sold over the counter. And the next one, vitamin B6, may shock you even more. Vitamin B6 is often advertised as a nerve or brain booster. But here's the hidden danger. Too much B6 can actually damage your nerves, sometimes permanently. Take Harold, a retired truck driver. He came in complaining of numb feet, tingling hands, and frequent falls. At first he thought it was arthritis or aging. But when I looked at his supplements, I found the problem. His nerve support formula contained 200 milligrams of B6 per day, more than 10 times the safe limit. B6 toxicity strips away the protective coating of your nerves, like peeling insulation off an electrical wire. The result? tingling, numbness, tremors, memory issues, and in many cases, permanent damage. Seniors only need about 2 to 10 milligrams per day, and most people get that from food. Yet many brain support supplements contain 50, 100, even 200 milligrams per dose. Harold's story reminds us, always check your labels. At this point, let's pause for a moment. Have you found this eye-opening so far? If yes, take a second to subscribe to The Healthy Body. That way, you'll never miss life-saving tips like these, especially ones that help you stay sharp and independent after 60. Now let's move on to vitamin A. Most people think of it as the eyesight vitamin. But in high doses, vitamin A builds up in the body and can cause dangerous pressure inside the skull, mimicking a stroke and even leading to permanent vision loss. Dorothy, a 79-year-old piano teacher, learned this the hard way. She was taking 10,000 IU daily for years, thinking it would protect her skin and eyes. Instead, she developed headaches, blurred vision, and slurred speech. Tests revealed elevated pressure inside her brain caused by vitamin A toxicity. Unlike water-soluble vitamins, vitamin A is stored in the liver, tissues, and even the brain. Over time, it accumulates and creates damage. The safe upper limit for older adults is about 2,500 to 3,000 IU per day, yet many supplements far exceed that. Finally, let's talk about niacin, also known as vitamin B3. It's often marketed as a natural way to lower cholesterol. Some doctors even prescribe it. But in high doses, niacin can trigger sudden swings in blood pressure and increase stroke risk. Take Frank, an 82-year-old retired postman. He was taking 2,000 milligrams of niacin daily from an over-the-counter heart health supplement. Soon he started experiencing hot flashes, dizziness, and a pounding chest. Then he suffered a mini-stroke. The reason? Niacin causes blood vessels to expand and then snap back, stressing the heart and brain. For older adults, anything above 50 milligrams per day should only be used under medical supervision. Yet many supplements contain hundreds or even thousands of milligrams. So what's the takeaway here? It's not that vitamins are bad. It's that too much or the wrong kind, at the wrong time, can be dangerous, especially as we age. And here's the hopeful part. Your body wasn't designed to run on pills. It was designed to thrive on real food. When my patient Margaret replaced her drawer full of supplements with simple meals, like eggs, avocado, whole grain toast, berries, nuts, and fish, her dizziness faded, her blood pressure stabilized, and her mind felt clearer than it had in years. That's the real secret. Whole foods provide the nutrients your brain needs, in the right amounts, without the risks. Leafy greens, fatty fish, berries, nuts, seeds, and whole grains are some of the best supplements you can give your brain. They don't just protect your memory, they support your heart, bones, mood, and mobility too. Every bite becomes a step toward healing. So remember this, awareness is your most powerful medicine. At 60, 70, or 80, your body processes vitamins differently than it did decades ago. Even good habits, like taking supplements, can backfire if you're not careful. Always read labels, check dosages, and talk to your doctor before adding anything new. If this video gave you something to think about, let me know in the comments. What's one change you'll make starting tomorrow? And if you found this helpful, subscribe to The Healthy Body. Together, we'll keep learning, growing, and protecting the health that matters most. I'm Dr. Alex, and thank you for spending this time with me here on The Healthy Body. You're never too old to take back control of your health, and you're never alone on the journey.